Why does bladder underactivity lead to overflow incontinence? Imagine a bladder that's supposed to fill and then empty smoothly, like a well-functioning pump. When the bladder muscle, known as the detrusor, becomes weak or cannot contract properly, it struggles to do its job. This condition is called bladder underactivity or detrusor underactivity. Because the muscle isn't strong enough to push urine out fully, urine begins to collect in the bladder, leading to urinary retention. The bladder keeps filling up, stretching beyond its normal size, which increases the pressure inside. As the bladder becomes overfilled and distended, it can mechanically force urine out through the urethra, even without the usual sensation or urge to urinate. This involuntary leakage of urine is what we call overflow incontinence. Essentially, when the bladder cannot contract properly, it cannot empty completely, so residual urine remains. Over time, this residual urine causes the bladder to stretch further, making it easier for urine to leak out without warning. Several factors can cause this weak bladder muscle. Nerve damage from conditions like diabetes, multiple sclerosis, or spinal cord injuries can impair the signals that tell the bladder to contract. Aging naturally reduces muscle strength and nerve function, which can contribute as well. Certain medications, especially those that relax or weaken the bladder muscle, such as anticholinergics or opioids, can also play a role. Chronic bladder outlet obstruction, often caused by an enlarged prostate or urethral strictures, can lead to fibrosis and weakening of the detrusor muscle over time. In men, prostate enlargement is a common cause of obstruction, which can lead to the bladder working harder but failing to empty fully. In women, severe pelvic organ prolapse can kink or block the urethra, causing similar problems. When the bladder cannot contract effectively and urine keeps accumulating, the pressure builds up. Eventually, this pressure causes urine to leak out involuntarily, even without the typical urge to urinate. It's important to understand that overflow incontinence is more common in men because of prostate issues but can also happen in women, especially with severe pelvic organ prolapse. The key is that the bladder's inability to contract properly, combined with any outlet obstruction or nerve damage, results in urine building up and then leaking out unexpectedly. If you or someone you know experiences symptoms like frequent dribbling, a feeling of incomplete bladder emptying, or involuntary urine leakage, it's essential to see a healthcare professional. Proper diagnosis and management can help address the underlying cause and improve quality of life. Always remember, individual cases vary, and a tailored approach is best.